My name's Andrew Skyrme. I'm one of the consultant hip and knee surgeons here at the Horder Centre. I've been here for some 20 years. I'm one of the oldest here at the present time. As patients, you'll now all be aware that there are many techniques. The main discussion is whether you have standard open surgery or minimally invasive surgery. As a surgeon, as a hip surgeon here at the Horder Centre, I carry out minimally invasive hip surgery, and I do that for multiple reasons. The first thing is that it's less traumatic to you as a patient, and if there's less trauma, it generally means your recovery is quicker. And so what we're finding here at the Horder Centre is that patients are up and walking the same day and are often going home either the same day or even the next day. And so your recovery is just that much quicker. As a result, there's less bleeding, less blood loss, and less pain. And as a sidebar, the scar on the outside is smaller. There are multiple surgeons here at the Horder Centre who are happy to carry out minimally invasive surgery. I'm not the only one. For the most part, we were taught by one of our good colleagues, Hugh Apthorpe, who has probably done most of the pioneering work in minimally invasive hip surgery. I would suggest you could divide it into stages. Those stages, first of all, being the hospital stay. For the most part, we look after you whilst you're in hospital, but I think you can plan to be in hospital for between 1 and 3 days. The second stage of recovery is between the day you go home and week 2. For the most part during that period of time, you want to be taking it easy at home. You don't want to be doing cooking, gardening, cleaning, ironing. You want to be taking it easy at home. Ideally, if there's somebody else at home to be looking after you, would be great. I tend to call patients at week 2 to make sure they're doing fine. If you're doing fine at the end of week 2, I like patients to drive. And I then suggest that the next recovery stage is from week 2 to week 6. And during that period of time, it's a slow return to normal activities and just allowing things to gently improve. We give you guidance on that. There's a booklet that gives you milestones, but my advice is just each day inch forward. By the end of week 6, the majority of your pain will have improved. And at that point, you can really start to reintroduce normal life. And so if you're a keen gardener, you can start to garden. If you're a keen walker, you can start to increase your distance. If you're a golfer, start to swing a club. And then by the end of month 3, you should be 98% better. One of my retired colleagues from many years ago, Ken Ross, a lovely surgeon from Eastbourne, said that 98% of the recovery happened at 3 months, 100% took a year. So that tiny little bit at the end sort of gets better over the last year. The easiest way to answer that is to say that my mother and my father have both had surgery here. One lives in Surrey, one lives in South Wales, and they've bypassed multiple hospitals for their operation, and they've arrived here. Why have they come here? The reason for that is the Horder Centre is now a centre of excellence. It is the busiest hip and knee centre in the independent sector in the United Kingdom. 4 or 5 of the surgeons here are the busiest surgeons in the country. And again, these statistics are nationally available and they're very easy to find. Everybody here at the Horder Centre is geared to your healthcare. And that's not just the consultants, the nurses in theatre. All they do all day, every day, is hip and knee replacements. All the ancillary staff, the cleaners, the cooks, the man who works in the car park, everyone here knows that you're having a hip replacement on this day, and they're all geared to your healthcare. And so I've got absolutely no reservations in suggesting that the Horder Centre is the right place for you.